10 early signs of dementia most people miss. An estimated 7.1 million Americans are currently living with Alzheimer's disease. And according to NIH-funded research, early dementia is frequently missed, even by primary care doctors. The reason it gets missed is that the earliest signs look almost exactly like normal aging. They're subtle, easy to explain away, and most families don't recognize them until the condition has been progressing for months or even years. Today we're going to cover the 10 early signs of dementia that are most commonly overlooked. And just as importantly, what normal aging looks like by comparison, so you know the difference. Sign number 8 is the one that surprises families most. Welcome to Senior Wellness Guide. Sign number 1. Memory loss that disrupts daily life. This is the most well-known sign, but the distinction matters. Forgetting a name and remembering it later is normal aging. The early dementia sign is asking the same question repeatedly within minutes, forgetting recently learned information entirely, and becoming increasingly dependent on notes or family members for things previously managed independently. The pattern, not the single moment, is the signal. Sign number 2. Difficulty following plans or working with numbers. Normal aging might mean making occasional errors with bills. The early dementia sign is difficulty following a familiar recipe that's been made for decades, losing track of monthly finances that were previously managed easily, or taking significantly longer to do tasks that once felt automatic. When familiar things suddenly feel confusing, that is worth noting. Sign number 3. Trouble completing familiar tasks. Not learning a new skill, that's normal. The sign is struggling to drive to a location visited hundreds of times, forgetting the rules of a game played for years, or becoming unable to organize a grocery list that was once routine. Sign number 4. Losing track of time and place. Briefly forgetting what day it is. Normal. The early dementia sign is losing track of dates, seasons, or the passage of time entirely. Getting confused about where they are or how they got there, even in familiar surroundings. Sign number 5. New problems with vision and spatial awareness. This is one of the least known early signs. Difficulty judging distance, trouble reading, or problems identifying colors and contrast, not caused by an eye condition, can be an early neurological sign worth discussing with a doctor. Sign number 6. Trouble finding words or following conversation. This goes beyond occasionally searching for a word, everyone does that. The early dementia sign is stopping mid-sentence because the word is completely gone, substituting unusual words that don't quite fit, or having difficulty following a conversation or repeating the same story multiple times in the same sitting without awareness of doing so. Sign number 7. Misplacing things in unusual ways. Not just losing keys, putting them in the refrigerator, placing the television remote in the bathroom cabinet, and crucially, being unable to retrace steps to find the item. Sometimes this is accompanied by accusing others of stealing or hiding things. That combination, misplacement and accusation, is a clinically significant pairing that families often don't connect to cognitive change. Sign number 8. The one that surprises families most. Poor judgment and decision-making. Not an occasional bad decision, that's human. The early dementia sign is a pattern of unusually poor judgment that represents a genuine departure from character. Giving large sums of money to telephone scammers or strangers. Wearing summer clothing in winter without noticing. Making significant financial decisions with no apparent rationale. The Alzheimer's Association notes that financial vulnerability to scammers is one of the earliest and most measurable expressions of declining judgment, and it is almost never recognized as a dementia sign in the moment it happens. Sign number 9. Withdrawal from social activities and hobbies. A person who previously loved card games, church, or social gatherings gradually stops attending, not from tiredness, but because following the activity has become confusing or exhausting. This withdrawal is frequently interpreted as depression and treated as such, when the underlying cause is cognitive. Sign number 10. Changes in mood and personality. The American Brain Foundation identifies mood changes as one of the most commonly overlooked early signs. Increased anxiety, unusual suspicion, sudden irritability in previously calm individuals, or a loss of initiative and spontaneity. What makes this particularly difficult is that these changes can precede any obvious memory symptoms, meaning families notice the person seems different long before they can articulate why. Recognizing one of these signs does not mean a diagnosis of dementia. Many of these symptoms have other causes: medication side effects, vitamin deficiencies, thyroid problems, depression, or even sleep deprivation can all produce cognitive symptoms that are fully reversible. That is why the first and most important step, if you or someone you love is showing several of these signs consistently, is to speak with a doctor. Not to search for answers online. Not to wait and see. According to the NIH's 2025 Progress Report, early detection allows far more rapid access to treatment options, support resources, and quality of life planning than late diagnosis. The earlier the evaluation, the more options are available. A new blood biomarker test, PrecivityAD2, can now predict an Alzheimer's diagnosis with 88 to 92% accuracy. Ask your doctor if it's appropriate for your situation. The 10 early signs: memory loss disrupting daily life, difficulty planning, trouble with familiar tasks, disorientation, vision and spatial changes, word-finding difficulty, misplacing things unusually, poor judgment, social withdrawal, and mood or personality changes. Any one sign alone may mean nothing. A pattern of several, occurring consistently over time, warrants a conversation with a doctor. Subscribe to Senior Wellness Guide for new videos every week. Drop a comment. Was any of these a surprise? See you in the next video.